Καλησπέρα σας. Έχουμε την τιμή να φιλοξενούμε στο ιατρείο μας τον καθηγητή Menno Vriens, ο οποίος έχει έρθει από το Πανεπιστημιακό Νοσοκομείο UMC της Ουτρέχτης, της Ολλανδίας. Ο κύριος Vriens είναι καθηγητής χειρουργικής, είναι ειδικευμένος στην ελάχιστα επεμβατική χειρουργική ενδοκρινών αδένων. Έχει στο παρελθόν θητεύσει σε πολύ μεγάλα νοσοκομεία του κόσμου, στις Ηνωμένες Πολιτείες 2 έτη, στο Σαν Φρανσίσκο, στο Σικάγο. Επίσης, κατά το παρελθόν έχει κάνει πάρα πολλές επεμβάσεις Θυρεοειδούς στο Κίεβο της Ουκρανίας, σε ασθενείς που είχαν νοσήσει λόγω του ατυχήματος στο Τσερνομπίλ. Menno, it's a very, very big pleasure to have you here in Greece. We had some operations today. We had minimally invasive thyroid surgery, the so-called TOETVA. Please, Menno, tell us your opinion about TOETVA.
Yes, well, Aristoteles, kalispera. It's a true honor for me to be here with you these days in Athens. We know each other already for a long time, and you spent the time with us in Utrecht in the Netherlands as a fellow in surgery. And as a matter of fact, you were one of the most excellent fellows we had.
Thank you.
So when you asked me to come over to do the TOETVA together, it was a big honor for me. The TOETVA stands for the total transoral endoscopic thyroidectomy via the vestibulary approach. That means you operate somebody on his thyroid and you take the specimen through the mouth. And it sounds like a very strange way of operating, but the technique that derives from Asia, actually in Bangkok, where Angkun Anuwon was the guy who started it, bits and bits, it starts to conquer the world. And I think it's a very elegant technique. The benefit of the TOETVA is that you avoid a scar in the neck, which can be harmful for people. And you do that because you know if you bite into your lip in the inside of your mouth, the scar of the tissue will heal very easily, and you don't see a scar at all. We did a systematic review in our institute looking at an open thyroidectomy, a robot-assisted transaxillary surgery. That means you take out the thyroid via the armpit with the robot, and the TOETVA. And the chances of complications are very low in all the procedures.
Exactly.
I think it's very important though that the surgery is done by surgeons who do thyroid surgery a lot, and who for the TOETVA have a lot of laparoscopic experience as well. So I think the people in Athens are in good hands with you because you have experience in both techniques.
Thank you, Menno. Actually, I would like to ask you, first of all, it's very important for us. Together we have operated very much.
Yeah.
Also, Dutch patients, we have done minimally invasive surgery of the thyroid gland and the parathyroids.
Yeah.
It was very fascinating. Actually, you introduced me to the technique. It's a fascinating technique, and actually what you mentioned is that the TOETVA is a technique that it's transoral. So
yeah.
For the people to understand, it's a technique that it's operated through the mouth,
yeah.
but it does not have any pain,
no.
and it is used, laparoscopic technology is used. So
exactly.
we use laparoscopic instruments through the mouth,
yeah.
so we avoid the scar.
Exactly. And as said, people don't have any pain after surgery actually, and surgery lasts as long as open surgery, and they go home the same night, or in some cases the next morning. So it's very easy going, and again in well-trained hands, it's a very nice and elegant technique.
So Menno, for TOETVA, from what you tell us and from your experience, it is so that somebody should be proficient in thyroid surgery and
yeah.
in laparoscopic surgery.
Exactly.
So to make it plain for people who may be listening this conversation,
yeah.
it is so that thyroid surgery for more than 100 years, actually from the end of the 19th century, is an open procedure.
Exactly.
This means a wound here in the front of
Low
the
in the
neck.
neck. Yeah.
So in the recent years, we have now this TOETVA that you said that started in the Far East, and now it came to Europe.
Exactly.
There are very few centers in Europe that they perform TOETVA.
Yes, exactly.
It's your center, and also in Italy. One center is Sicily. Now we start in Greece, thanks to you. So what are, if we could summarize, please tell us the benefits of the TOETVA. What is the aesthetic result, and what are the total benefits of a patient who needs thyroid or parathyroid surgery and who prefers to take TOETVA instead of the traditional open surgery?
Yes, well, as said, the ultimate benefit of a TOETVA is cosmesis. So you avoid a scar in the neck. So people with a nodule or sometimes with thyroid cancer want to avoid a scar in the neck. And if you do it through the mouth, you won't see a scar at all. So that's actually the benefit. And again, the chance of a complication is as low as it is in open surgery. So that's a true gain for patients who have this problem.
And Menno, so TOETVA is an emerging surgery. I would like to add that TOETVA started from Far East because the people there, they wanted to avoid a scar in the front of their neck. Otherwise, especially women, could not be proposed.
Exactly.
So it was very important for Far East people.
Yeah, so I went to Angkun Anuwang in Thailand to see him perform these procedures. And I was able to perform the procedures there myself, and then took it to the Netherlands, and it is a big success ever since. So I'm very happy to help my patients with this new technique. Not only for thyroid surgery, but for example another operation we do a lot, both adrenal surgery. I think minimal invasive surgery really has a gain for these patients because you make really small incisions and the healing process is so much better than with open surgery with big scars and big wounds that the patients really benefit of the minimal invasive surgery we perform with maximum result. So that's really
this is fascinating. This is fascinating.
Yeah.
So Menno, you have been operating for many years in various countries for thyroid surgery. In the beginning of your career, you did much open surgery. You assisted many people, even in Ukraine. Which years you were in Ukraine?
I was in Ukraine in 2008. So that was 22 years after the Chernobyl disaster. And we still operated on Chernobyl patients. I was there with my good friend Sergei Cheryenko, who is still there, and I have lots and lots of contact with him because of the current situation. It's really horrible, and many Ukrainian people come to Europe now. And we have to give them all our support.
We must give all our support.
Exactly.
Incredible things happen there in Ukraine. I have also friends in Ukraine, like doctor friends. I have contacted. It's shocking what has happened. I would like to ask you, you have helped many Ukrainian people, and to make it plain for people listening to us, Chernobyl means it was a nuclear blast, so these people, they suffered other things before the current war.
Absolutely.
So they have had difficult life. And this means that this nuclear blast in 1986, it created a huge amount of thyroid cancer.
Exactly.
What I want to say is that you have operated so much in your life in difficult places like Ukraine, open surgery. What was your feeling when you made the transition to minimally invasive endocrine surgery? So taking out the thyroid or parathyroid without any scar on the skin. What was your own impression? How fascinating that was? And also, what was the acceptance of the scarless thyroid surgery from the Dutch society or your Dutch patients?
Well, in the beginning, of course, people think it's a crazy idea. You get your,
I thought in the beginning.
You got your thyroid out of your mouth. What are you doing? But it's not so crazy as it sounds. And Michael Ye, one of the surgeons in Los Angeles, once wrote an editorial about it. Taking out your thyroid through the mouth might sound not so crazy as it is. Because, well, you have seen it, we've done one case together today. It's a beautiful way to go.
Very beautiful,
and the plane is so clear. You have to change your mind because you look 180 degrees different than the traditional
open surgery.
Open surgery. But yeah, I mean, we've been there thousands and thousands of times, so we know where the recurrent nerve is,
exactly.
The vocal cord nerve. We know where the parathyroid glands are, and if you can do it like this, it's really very beautiful, and we can really help our patients.
Yeah, it's very beautiful, and I remember because I started this procedure with you in the Netherlands.
Yeah.
So I remember in the face of your patients how fascinated they were.
Yeah.
Also our Greek patients that
Yeah.
we have operated also together.
Yeah.
Actually, they are looking very much into that.
Yeah.
Who do you think are the candidates, the candidate patient who
Yeah.
would be eligible for thyroid surgery?
Yeah.
With TOETVA, and also will the eligibility expand in the near future?
Of course. So I think a good candidate is a person that has a thyroid nodule, where the cytology, it means that preoperative, the radiologist takes a needle sample out of the nodule, and we, based on the pathology report, we don't know whether it's cancer or not. You know that, of course. We do a diagnostic procedure, and with the diagnostic procedure, you might imagine that you don't want to have a scar in your neck,
exactly.
Which is very visible, and eventually you hear that the nodule, for example, is no cancer. Then you have like a scar in your neck for a diagnosis which is benign, which is beautiful, of course. It's good news. So that might be an indication. What also might be an indication for somebody with cancer who is eligible to have only one lobe out, to have the procedure via the TOETVA. The most important thing is though that you need to see the surgeon himself or herself who performs the operation. So together with your surgeon, you make the choice of an open or a TOETVA procedure. And that depends on how a patient is built, if he has or he or she has a tall neck, what the relation is of the size of the nodule compared to the size of the neck. All kinds of things are so detailed, you need to be seen by an experienced surgeon.
Good. So in order to summarize, the TOETVA technique is so that it can be offered to many people that they
Absolutely.
need thyroid surgery.
Yeah.
The eligibility for TOETVA is expanding because the technique is very recent, but in the near future there will be more and more patients that they can be treated with TOETVA.
Exactly.
And in the current situation, the eligibility for TOETVA is very much based on the clinical judgment of a very experienced surgeon.
Exactly.
So in conclusion, TOETVA is an aesthetic operation actually, an operation without any scar.
Exactly.
I would like one comment, one question only for the adrenal surgery that you mentioned before. As you know, Menno, we have published together, we have created adrenal videos together, also TOETVA videos. Your center, also my center in Greece, are high volume centers of adrenal surgery. We do it with for the people to understand, we do this surgery with a minimally invasive retroperitoneoscopic technique, which means via the back. It means 3 small holes in the back of the patient, and to extract huge tumors, even tumors larger than 8, 10, 12 centimeters.
Absolutely.
And these patients, Menno, it's incredible. They don't have any pain after the operation.
No, that's true.
Most patients, they go some hours after or next morning
Yeah.
they are discharged to home,
Yeah.
and they don't need even paracetamol. In
No.
Greek it's depon, it's
Yeah.
called.
Yeah, yeah.
Please a comment about this posterior retroperitoneoscopic surgery.
Again, minimal invasive surgery has a lot of gain over open surgery, and with this specific retroperitoneoscopic approach, we know that what you say, patients have less pain, can be discharged sooner, don't need painkillers, and recover much quicker. So it's a true gain for the patients, and that's the beauty. I mean, it's not that we like the procedures ourselves, because from a technical point of view, the beauty is that with these minimal invasive surgery procedures, our patients benefit from it.
Exactly.
And that's what I like about it. And I said, I mean, you do a lot of research here in Athens, and you publish and you present on international meetings, and that's absolutely very cool, because I think if you perform surgery and if you have time to do research next to that, then you're really on top of things. So I really like to congratulate you with that.
Thank you very much, Menno. Lots of nice surgery have been done by us in both Utrecht and Athens. I would like only to add for people who are listening that the alternative for adrenal surgery is laparoscopic. This means transabdominal,
Yes.
which means 5 scars. And to put it in simple language, is that the surgeon should mobilize, should move out of the way all the bowels and the organs to reach the adrenal, which is back here.
Exactly.
So this is real minimal invasive surgery. Minimal invasive surgery for adrenals is only 3 small wounds back here,
without collateral damage.
and for thyroid is no wound anywhere.
Exactly.
Because the skin, actually the small wound inside the mouth will heal. Quickly.
Very quick. Yeah.
This is fascinating, Menno.
Well, what another thing is that is very fascinating is our mutual interest in art.
Yeah.
We haven't talked about that yet. Yes. And well, you're from an art family. Your father is really into painting, and I saw some beautiful paintings from him.
Thank you. Yeah. You said that everybody should be going to museums.
Exactly. So my quote is always, I think you become a better doctor if you look carefully and more carefully to paintings. Because if you train yourself to look more carefully to paintings, you train yourself, and especially the young generation, they should train themselves to look more careful to their patients. Because if you look to your patients in detail, then you have the diagnosis much quicker, and then you can provide a solution for the problem of your patient, a treatment much sooner. So for example, in Utrecht, all the medical students are offered a course in one of the musea in the Netherlands, in the Rijksmuseum in Amsterdam, where you've been.
Yeah.
Beautiful, one of the most beautiful musea in Amsterdam. And we train them to look in detail, we ask them questions to look in detail to the paintings. And we hope therefore that they become better doctors. I want to say that our hearts are with the people in Ukraine, because they have a very, very hard time, and Slava Ukraine.
Yeah, Slava Ukraine. Menno, I thank you very much.
You're welcome. Thank you so much for being here.
Thank you for coming here.